At Humber Teaching NHS Foundation Trust, we believe that patient, service user and carer feedback is crucial for improving our services and ensuring high quality care. Surveys provide a structured and efficient way to gather insights directly from those who use our services.
Surveys are used to gather valuable insights into our service user experiences, identify areas for improvement and ultimately enhance service user care and satisfaction. Within Humber Teaching NHS Foundation Trust, we have clear organisational processes for the coordination, analysis and dissemination of survey feedback and for the action planning that follows. Collecting and using the survey feedback of those who access our services helps to improve communication between service users and staff and builds trust and confidence in the NHS locally and nationally.
As a service user myself, I can appreciate that being honest about the care you've received can sometimes feel daunting and that it can feel hard to be motivated to complete a survey when you're not sure what happens as a result of the feedback you provide. I've been working with the Adult Mental Health Division as an expert by experience since last year, and I've worked alongside professionals to consider feedback provided through both the Mental Health Inpatient Care Survey and the Community Mental Health Services Survey. I was able to feed into action plans using the feedback provided by other service users and contribute my own lived experience to ensure that your views are listened to and that we can make positive changes to the way that care is delivered.
As one of the specialist clinical pharmacists, I work across community mental health teams throughout Hull and East Riding. Following your feedback that you would like to feel more supported with decisions about medication, we have focused on spreading the awareness of the Choice of Medication website within Humber Trust and have started to include this website on our letters. Choice of Medication is one of the most comprehensive independent websites for patients, carers and healthcare professionals for patient information. It has information available on mental health conditions and the medication used to treat them, which enables patients to make informed decisions about choosing the right medicine and the best treatment plan for them. It has medication-specific information leaflets available in multiple languages and easy-read formats. The website also has handy fact sheets so you can compare the side effects of different medication to support with shared decision-making between yourself and the prescriber. Pharmacists also work with the Recovery College and run medication workshops across various sites in Hull and East Riding. These 2-hour workshops are informal sessions where you can attend to ask any questions or to find out more about medication. Our goal is to support our patients to feel empowered in relation to their medication, from understanding their options to making informed decisions.
The Friends and Family Test feedback provides a valuable insight into what people are saying about the services we provide. Our teams look at the feedback on a regular basis to identify where we have got it right and where there is room for improvement. April 2024 saw the Trust launch its new Friends and Family Test dashboard, which is accessible to all staff and shows the results of the Friends and Family Test surveys received from patients, service users and carers who have accessed our services. It includes qualitative feedback comments around what we did well and what we could do better. All feedback received is thematically analysed into one of 10 themes and is also divided into positive and negative. Positive themes confirm good experiences and negative themes inform where there is the potential to improve. Where teams are not receiving Friends and Family Test responses, they have developed action plans to help to strengthen their approach in disseminating Friends and Family Test surveys to their patients, service users and carers.
The GP Patient Survey is a national benchmark survey that enables the Trust to understand locally and nationally how our GP practices are performing in the services we offer to our patients. The survey includes questions about a range of topics such as how easy or difficult it is to contact your practice, the quality of care received from healthcare professionals, the experience of NHS services when your GP practice is closed. The survey is sent out every January and runs for 3 months. The survey is sent to a random selection of people, approximately 2.5 million people registered with a GP in England. There is also an option to complete the questionnaire online. Results are published in July of that year. The answers we get help the Trust to improve our services.
So one of the key ways that we as an inpatient team get our feedback is from the inpatient survey. And with the information that we've got from that and how we've been sort of delivering it, one of the key areas that sort of highlighted to us was how we're engaging with carers and how we're supporting carers. From that then we obviously was able to take what was being said about our service, about how carers don't necessarily sort of feel supported and actually make some actions to really sort of improve that. So it looked at elements such as support for carers in peer support one-to-one sessions. It looked at support for carers in regards to reception meetings in which they get to meet the team and speak to our clinicians. And it also included a new sort of overall arcing development plan for how we're engaging with carers and how we're supporting them as well. And this covered various things from not only sort of those constant sort of phone calls and updates, but also providing that sort of carer support as well and any sort of signposting that might need doing.
Our 2023 Community Mental Health Service User Survey told us that only 17.5% of respondents felt they had received the help or advice they needed with finding support for the cost of living. To be able to effectively signpost our service users to such support, it is key to upskill our own workforce alongside our community and third sector partners. The Prevention, Recovery and Wellbeing Services deliver Making Every Contact Count training. The Make Every Contact Count is an approach to behaviour change that utilises the interactions that individuals and organisations have to encourage positive change around health and wellbeing. By making our Make Every Contact Count training available to staff members throughout Humber and to the partners we work alongside, we're encouraging a culture of confidence to have these vital conversations with those who access our services, supporting them to identify the areas they require help and signpost them to the advice and support they need.
At our Trust, we are committed to utilising the feedback gathered from our surveys as part of a systematic approach to quality improvement which transforms services to make them more responsive to service users and carers. Help us to continue to improve our services by taking the time to complete any of the surveys you are eligible or able to do. Your feedback really does matter to us.